Simulation centers typically are seen in medical schools. Hospitals like ours, which is essentially a community hospital with a lot of teaching, do not have simulation center. I believe in New Jersey there is only one other hospital which has a simulation center. So we are rather unique. So simulation is where we, under controlled conditions, teach students, residents, even practicing physicians certain skills. And that is the center we have established at St. Peter's.
The Simulation Center is a place where we can create simulated medical emergencies and we can run the teams expected to respond to those emergencies in the hospital. We can run them through those situations in a safe environment. It's a great place for people to learn. We take mistakes and turn them into learning opportunities.
The Simulation Center uses technology, high technology of mannequins, which can mimic real events in life. For example, you can make the mannequin bleed to death. You can make the mannequin deliver a baby.
So the purpose of the Simulation Center for interprofessional learning is twofold. You've got the Simulation Center, which is the high tech piece of it, and then you've got the Institute for Bedside Medicine, which is the old school hands-on approach to learning, where the residents get to practice interviewing and assessments with real people.
The Institute of Bedside Medicine, we use real patients and people, normal people as actors, to act out a particular script, and basically focuses on doctor-patient relationship, communication mostly. Trainees are observed how they talk. One of the biggest complaints we all receive is that doctors simply don't talk to patients. We teach them even how to knock on the door. That's simulation. That's simple to most complicated. For example, one of the complex skill we teach is breaking bad news. An example is a woman had a breast lump. A biopsy was done last week. The report is now she has a cancer. How do you tell this woman that she has a cancer? That's called breaking bad news. So we have a scenario, we have a person, not a patient, who acts as a patient, and the trainee is asked to inform this patient this bad news. And it's a 10-minute encounter, but may take 3 hours to teach. So next time, if the trainee has to go to the bedside and actually tell a patient that she has cancer, he's comfortable in talking because he has already rehearsed it in the Simulation Center.
The Simulation Center clearly benefits our patients by providing that practice for providers, and that's again for doctors, for nurses, for respiratory therapists, ancillary staff, so that we can practice all of these different techniques and also potential complications and apply that to real scenarios when patients are sick in the hospital.
When the Simulation Center was in its first year and a half, I believe, we had brought the OB residents downstairs to practice our maternal code blue drills. So if we lose the respiratory or cardiac drive in a mom, you've got a certain amount of time where you have to safely get that baby out, so you can take baby out, put the baby where they belong, and then you can keep caring for the mom. So we ran through these exercises several times, and 2 weeks later, the emergency actually occurred in labor and delivery. We had a mom suffer a cardiac arrest, and some of the participants who were there in the lab that day were on the team who responded that night. So they safely got that baby out. Baby went to the Well Baby Nursery. They resuscitated mom. Mom went to the adult ICU for about 3 days, and mom and baby were discharged together a few days later. It's a perfect snapshot of exactly what the Simulation Center is trying to accomplish.
Thank you for your support.
Thank you for your support.
Thank you for supporting clinical education at St. Peter's.